April is Autism Awareness Month, and this morning we're learning about promoting inclusivity and raising awareness.
Yeah, joining us this morning is Dr. Tranika Jefferson, a behavioral analyst with the Harris Center to keep the conversation going. Doctor, thank you for being with us.
Thank y'all for having me.
All right, so let's get into it, because you were saying you are a behavioral analyst, and this is Autism Awareness Month. So what should people really focus on this month, when it comes to inclusivity and being kind to others?
Yeah, I think one of the things that we should focus on as a community is kind of educating ourselves for those that don't know what autism is, and knowing that it's a spectrum. It doesn't look like one particular thing. It could be on the lower range where it's very mild, you could barely notice it, or more severe where the person needs more supports and services. So to kind of be sensitive in that aspect as we're talking about it, we're seeing different people in the community, places that we go to, that sometimes people need more support than we actually realize.
Yeah, what kinds of lessons can we, let's say even as parents, teach our kids? Let's start there.
Yeah, I think one of the lessons to teach our kids is being more accepting, and also making sure that we include other people that may have different divergent issues. Maybe they don't learn the same way that we learn, but knowing that, we are all, in this world together. We could learn, we could play, we could interact with each other, and not to exclude anyone out just because they may be different from, what we look like or what we do or how we behave.
And it really starts with parents, right? And they kind of lead by example. So if parents are acting a certain way when they're out with strangers, that's what the kids are going to really see.
Right. So one of my main things is like modeling that appropriate behavior. And so not even just, people that may have an autism diagnosis or a different physical abnormality or mental illness or a different race or ethnicity. It's like showing respect to everyone because our kids are watching. And so we want to be that model for them, and making sure that we're doing the appropriate behaviors for them to be able to imitate and model that behavior.
So I feel like there's a couple points to the Awareness Month. One is trying to learn how others are dealing with whatever they're dealing with. But then the other part is for families that may be questioning, is my child or the young person in my family dealing with autism? I feel like there's two different sides to autism awareness, right? What do you think about that?
Yeah, and I think that's very important. A lot of times when I meet people in the community and tell them what I do, they either have a child that they're suspecting may have autism, or there's someone in the family or a friend, and they're wanting to know, like, what are the signs and symptoms? So one of the main things that I tell parents is you can start noticing signs around 6 months, especially if you have other typically developing kids, and to compare their development to the kid that you're suspecting may have a diagnosis as far as hitting those developmental milestones. And then from there, if you're suspecting anything, you could always go to your child's pediatrician and ask them to do an initial screening. Although an official diagnosis can't be made until they're 2 years old, at least you kind of know, trying to prepare them for steps moving further, because we believe in early intervention.
Yeah, and early intervention is huge to kind of diagnose early and then get the therapy going, or the speech therapy or the interaction. Talk about that, how important early intervention is.
Right, so I've worked with, of course, young kids as young as probably 6 years old, and then also adults until they're in their 70s. And so it's very clear sometimes when I've worked with adults that never had early intervention because they've been so used to being conditioned for whatever that those problem behaviors may be, or whatever skill set where they're have a deficit in those skills. And so we've, as a field of behavior analysis, we've noticed more progress as it relates to when the kids age and get older, if that intervention is started earlier than later.
We understand that it's difficult to get that early intervention oftentimes because families have trouble getting that official diagnosis for whatever reason. Is it, do we not have enough doctors in this world? Do we not, like what does autism need to help
unfortunately, there's a lot of loopholes, I would say, in this system, and getting services up and running. Sometimes there's a delay in the diagnosis even being given. So even if the kid is 2 years old, in which they can at this time get the diagnosis, if they have it, sometimes there's a struggle with getting those appointments with their pediatrician or with the neurologist. There's a waiting list, a very long waiting list at a lot of places to even even get treatment started. And unless you have that comprehensive evaluation that says your kid does have autism, then of course your insurance won't pay for those services unless that evaluation is there.
Yeah.
What do you say to parents who are kind of in that situation? Would you say just keep looking, contact the Harris Center, or just keep looking for someone that will take you in to see your child?
Right, so I always appreciate parents that are more proactive and they go out and they research on their own. They come to me and it's like, hey, this is what I've done, like XYZ, and they have their own checklist. They have a list of things places that they would like their kid to go to get services. So I would definitely recommend the Harris Center. We provide a lot of services and support and different educational resources for parents that are even wanting to get more information about autism or any other mental health disabilities or mental illness that they may be assuming that their child has.
Yeah. So how can folks get in touch with you guys if they want to reach out and get more help or get some more guidance?
So you contact the Harris Center. So the website is theharriscenter.org, or you could call the phone number, and that's 713-970-7000.
Okay.
Right, Dr. Tranika Jefferson, thank you for
Thank
being
you.
with us.
Thank y'all for having me.
Appreciate it.